are a primary care practice, so we serve patients who are only a few days old to patients in their 90s. Our mission here is to serve those patients that lack insurance, that also cannot afford a lot of their medications.
A lot of patients just are really hesitant because they think they're going to have to pay an arm and a leg just to get the insurance coverage. And that's kind of what my job is, to try to reassure them that it's not going to cost them an arm and a leg.
It's the joy that you see in patients when you are able to spend the time with them that this office allows, and it's just how they improve their health.
I want to tell everybody that I am so thankful that Dr. Duncan is here, and thank God for her. And she gave me the correct medication for my health and the health of my son.
They trust us with their medical care. They trust us with their families. We know their life stories. We walk that journey with them, and we have the ability to provide outstanding primary care for our patients. They could not live the healthy, fully vibrant lives that they're living now if we didn't exist, if we couldn't provide that care to them.
When I'm sick, she helps me get better. I would come down here and she'll give me like a glass of water, and then I would go to the front desk and she'll give me my medicine.
Having a school nurse, I think, really helps to make an impact on keeping kids in school where they can, get their education where we want them to be. It doesn't affect their family where their parent has to call off work because their student is calling home to be picked up. So the nurse is able to make that call from a medical perspective to just really make sure that that student is healthy and able to learn.
When we have situations where students don't feel well, or maybe an accident, we have somebody who's trained on site who can kind of give us an immediate diagnosis.
In case of emergencies, she can come and help, and it just makes me feel way better and not doing it on my own.
When students come to see Lindsay for a medicine administration or some kind of regular checkup, she's been able to develop a relationship with a lot of those kids that sometimes they may not necessarily feel comfortable talking about with other staff members. So she truly is kind of a full member of our staff, even though she's fulfilling these dual roles.
She has her door open all the time for any of us.
Establishing that trust is the key to them listening to anything I'm going to say to them. And so having somebody available to listen is probably one of the main things that they say is helpful. And then they can come back to me with other health needs, with other questions they have. My main goal is to get people established with a real physician, PA, nurse practitioner, something within a practice that they can stay with for life. So I just do tons of work with them to try to get them into somebody who's going to follow up with them and that they can establish a relationship.
I can't even express what the Lord has sent here for us through her, her healing touch and her love that she passes through to us. It's awesome.
I think it's very sacred for people to let you into their lives, and I have the honor of being able to do that with my job. And so I just feel blessed myself that we can work together toward them finding their health.
Some women avoid coming in for their mammogram because of the cost or lack of insurance coverage. And at Holland Hospital, to help with that, we've established the Breast Care Fund.
The Breast Care Fund helps pay for screening and diagnostic mammograms, ultrasounds, MRIs, biopsies. It pays for the imaging fees, but it pays for the radiologist to read the images, the pathologist to process any biopsy specimens. So it really encompasses a lot, and it just allows women to get the care they need and deserve. And we're able to catch early breast cancers.
Because we do see what happens when a breast cancer is left to grow and does not get addressed. because a patient is worried about pain or that kind of thing. So I'm really proud of the fact that we're able to offer that.
50% of our outpatient behavioral health patients are children ages 11 through 17. It's about 80 a day going through those doors. So that kind of gave us a focus. And with that, we reached out to our school nurse program and met with the superintendent of Holland Public Schools, Brian Davis, and learned that there was 100 suicide risk assessments being performed every school year between the high school and the middle school. And that quickly became our calling. The goal of this program is to walk alongside these families and with their student and their children during crisis situation. Someone that understands the school environment and the medical field.
That's where I come in and I just walk along with that family and that student. I help them understand the process for getting mental health care, what resources are available out there, and then I also make them realize the follow-through. My feedback from families is that there's this huge relief knowing that someone at school is available and knowledgeable to help them during what's really a difficult time for the whole family. In supporting them and helping that family and that student get the help they need, and then someone there to transition. That's the key to the role, is that transition that comes back to school.